Now, when a patient comes with Cushing syndrome symptoms, first you have to confirm the diagnosis. Then you have to locate the cause. First, to confirm the diagnosis, you do a low-dose dexamethasone suppression test. Dexamethasone is something just similar like cortisol. You give a tablet of dexamethasone. What should happen is that usually what happens in the morning, the level of cortisol is high. That is due to diurnal variation that normally happens in every one of us. In the morning, the cortisol level should be high. But when you give a low dose dexamethasone, that is a steroid, this steroid goes to the ACTH and goes to the pituitary and decreases the production of ACTH. So, if decreased ACTH, then there will be decreased production of cortisol. So, when you check the levels of cortisol in the morning, it would be decreased. But whenever the patient is having a Cushing syndrome, even though if you are giving this low dose dexamethasone, that dexamethasone would go to the pituitary and decrease the ACTH. But the level of cortisol would be still high, because in Cushing syndrome, the cortisol could be coming from anywhere else. So, with the low dose dexamethasone suppression test, you would confirm the diagnosis of Cushing syndrome. Now, you have to find the cause. To find the cause, we do check the level of ACTH. If the ACTH is low or high, we have different causes. If the ACTH is low, the probable cause would be exogenous steroids or adrenal tumors. If the ACTH is high, we do a high dose dexamethasone suppression test. This high dose steroid is just enough to suppress the pituitary adenoma that is secreting ACTH. Remember, before I said there is a pituitary adenoma secreting ACTH which would not respond to the negative feedback. But when you give high doses of steroids, those high doses would go to the pituitary and suppress the ACTH production. So, by this way, we can differentiate the cause. If the ACTH decreases, that would be a pituitary tumor. If the ACTH is still high, then the problem is coming from the ectopic, that is from the lung cancer or anywhere else like pancreatic cancer. So with this algorithm, you can diagnose Cushing syndrome and find the cause as well. That's all for today. Thank you, doctors.